For 2 weeks, this Mexican crematorium has been going day and night. The exhausted workers told us that almost all of those here are COVID victims.
We are working the triple what we usually do. We just can't keep up. Before, we cremated between 1 and 3 bodies a day. Now, it's up to 15 or 20.
The country's official COVID death toll is at just over 3,000. That's in a country of almost 130 million people at the peak of its epidemic. There are fears in reality it could be higher. Other crematoriums report they're also at max capacity, like this one in IXTAPALUCA, on the outskirts of Mexico City.
Sometimes our ovens are so saturated we have to cremate the following day. We leave the bodies at the hospital because we have no room for them.
The country's coronavirus czar said in April that the real number of cases are likely to be at least 8 times higher than the official figure. Many other countries also admit a data gap, but it could be bigger here because the testing rate is so low, and that goes for fatalities too.
Patients come, particularly in phase 3, in a serious condition, which doesn't give us the chance to do the test. It could be done after death, but that rarely happens. So we have people that die and have the symptoms of COVID, but aren't registered as such.
But some local governments say that on top of those problems, the death tolls they've reported haven't been reflected in the federal count.
They counted us as having 24 dead, but we had 87, more than 3 times more than that.
Up until last night, we had 54 people who died of COVID-19, according to their medical certificates. And in the daily roundups from the state and federal government, they've only registered 16 deaths.
And meanwhile, the fatalities continue. At this local cemetery, they told us they've been taken up to 4 times the normal amount of bodies. Amid the worries for some over transparency, there is also cause for optimism. The capital's health system, although suffering from a lack of equipment and at times coordination, is still not overwhelmed, even though the government says that the epidemic in the country has reached its peak. The government's hoping that it can get through the peak period without a huge jump in the death toll, whatever that really is. John Holman, Al Jazeera, Chimalhuacán.